I'm Tish West, and this is my husband, Bill West. And Caroline West is the youngest of 4 children in our family. And she has major disabilities and medical complex issues. It was kind of a shock when she was born, but we've had lots of great support along the way, and it was really a blessing when we found the complex clinic, because medically we were not getting all the support that we needed.
You go to the hospital, you go to the emergency room, or you go to some physician, the first question that the nurse asks is, are there any underlying medical conditions? And we got to the point we'd say, well, how much time do you have here, right?
Seeing the neurologist, and he basically was very pragmatic and said, she won't live past 18 months, take her home and spend time with her.
We met Dr. Placencia when Elizabeth was in the ICU, those 6 months on and off. And we found out in 2001 that he was starting this clinic.
There are some people who are affected so severely that they are not able to do anything for themselves. And patients like that, patients who are reliant on technology just to live, maybe they need to get their nutrition through a feeding tube or something like that because they can't swallow or they can't breathe on their own reliably. Those are the types of patients that we're seeing.
And so many of these kids with complex issues, when they go to the hospital, they come in through the ER, but the next place they go is ICU. And so it's really expensive to keep them in the hospital 2, 3, or 4 days. What we found when we were fortunate enough to find the complex clinic is that there were just multitude of times when an early intervention kept her out of the hospital.
I was remembering when Elizabeth required her scoliosis surgery, and Dr. Placencia helped us get several opinions, and we finally did get it done, modified. We had been monitoring her scoliosis year after year, but they're like, well, her curve is just going to change. It's going to start impacting her lungs, even with the ventilator, and she'll at some point not be able to breathe. So it would have been a miserable way. She would have been suffering. So to be able to do this surgery was huge for us. And our doctor gave all the credit to Dr. Placencia that it was his confidence that he knew her so well, knew she could get through it.
The wraparound services that we're able to offer, and then in particular, the care coordination that we're able to offer as an integrated piece of our clinic is really what makes our clinic special. It's being able to take care of the entire family and all of their needs, all of that patient's needs.
Trips to Disney was something she looked forward to all year long. It wasn't easy to get her to Disney with all her equipment and supplies and medicine, but we did it, and it meant the world to her.
And that's the level that they went beyond to not only just make sure her care was there, provide this confidence level, and then coordinate very, very simple things to most families were very complex things for our family. And they gave us the ability and confidence to do that, which was, life-changing experiences for all of us.
And so when we came to the complex clinic, it became a center of our lives because her medical issues were so complicated. And we spent a lot of time here, and we became friends with everybody, and they became a huge support of our whole family.
As a parent, one of the wonderful things is Elizabeth was never scared to go to the clinic. And it was like she was going to see her family and friends.
It's a really vulnerable time for these patients. So many of them wind up in the hospital, so many of them wind up suffering setbacks when they're trying to make this jump because of the delays in care that can happen, because of not having the specialty care that they need, etc.
I remember just sitting at the house, watching her get sicker and sicker, and just not knowing what in the world to do.
I don't want to say we were dismissed at times, but we were dismissed at times, so I'll say it.
We felt like before we were a team, and I guess when we got into the adult world, it was almost like we were just not fighting everybody, but we were always having conflicts, trying to get what she needed. Elizabeth had a wonderful life. She was such a loving child. She was so passionate about things. And I know Joe and I believe that she was our greatest gift. And we have so many wonderful memories, even though she's not here with us.
Having directly experienced this, if that experience motivates us and other families and donors. I mean, I think it's a beautiful legacy for her, and I think she would be smiling down and be extremely happy.
Every life is precious, and they deserve to have excellent quality of life too, and something like this clinic has the ability to really make a huge impact in the quality of life for a ton of patients and their families in this area.
They told us on the first day there was a 25% chance she wouldn't live through the night. So that's where we started. And so to see her 26 years later thriving and doing well, it's a testament to her constitution, but it's as much a testament to the medical care that she's been given all along the way. She wouldn't be here without St. Joseph's.